Hey, I am JC the NP. Welcome to another video. Coming to you from a call room today. I'm on call, so we're sitting in a call room waiting to be called in, so I may have to cut the video short. I apologize if I do. We're going to talk about RVUs today. What are RVUs? Why are they important? And what does it mean when we talk about RVUs? Okay, and how do I maximize my RVUs? All those things we'll get into today. First thing is RVUs. What are they? Means relative value unit. And what that means is we're attempting to discuss and discern value over time. So we're trying to figure out what our value is for the amount of time that we're working. Okay, and you can actually calculate that. It's pretty simple. I'll kind of go over that a little bit as we go through this. And I'll leave some links in the bottom of the video which will help a little bit. Okay, first thing, understanding what your value of time is. Now, when we talk about this, I'm going to talk about family practice numbers just because it's the widest audience. However, that does not mean that this does not apply to any other field. Okay, so for instance, if we're discussing family practice, the bell curve in family practice is over 213s, right? 213 is your most common visit type. Okay, and if you're talking about internal medicine or nephrology, then you're going to bell curve out over 214. So your general productivity is going to have a higher value because you have more complicated patients as a base, so you have a higher CPT code. Okay, so when you look at this, we're going to go back to family practice now. The average code is a 99213, and a 99213 has an RVU value of 0.97. Okay, so almost 1. Okay, and what does that mean? Well, when we talk about valuation, we use Medicare as our base rate because it is the lowest reimburser. So when we talk about that, we want to know what our lowest value is so we can determine value over time. Okay, and we don't start at the highest value because you're going to have patients that come in under that. So if you start at the lowest value, then you have a good idea of what your income is. Okay, of course, if you have a high population of insured patients, that's going to be different. You're going to be reimbursed more per. Okay, so when we look at this, Medicare reimburses a 99213 at $55 per. Okay, on average, it varies depending upon location, but the average across the country is $55 per RVU. So when we take that valuation, that gives us a good idea of what our value is. So if we see one 99213, it's worth $55, okay? And then 99213 is 0.97 RVUs, or essentially 1. So we estimate at the value of 1, okay? Don't estimate when you're actually calculating your RVUs. You need to get the actual numbers and base it off of that, okay? So that gives you a good idea of what we're talking about. Now, when we go through this, we are able to determine what our RVU value is based off of that. So if we have one patient a day and we work 5 days a week, then we're sitting at a valuation of $55 per patient, okay? So bear with me a little bit. I have to do some calculations on the computer so I can make sure that I give you the appropriate information. I don't want to give you bad numbers. Okay, so just bear with me as I calculate. So if we're seeing 20 patients a day, 5 days a week, 52 weeks a year, that gives us an RVU valuation of 5,200, right? So 5,200 patients, and we're estimating at 1. Now, if we want to be accurate, we multiply that times 0.97, okay? And that gives us a valuation of, excuse me, my calculator decided to be a little jumpy there, 5,044. Multiply that times 55, that gives us $277,420 is what our valuation is for seeing those patients. Now, that's if you do nothing else. There's no other additions to this, okay? And we have to determine what our value is per. And if that's what we're bringing in, that's what we're bringing in. Now, in order to up our RVU generation, we can do things like smoking cessation. If it's documented appropriately, smoking cessation is a 99406, which gives you 0.24 RVUs, okay? And remember, when you document smoking cessation, it has to have the time, and you have to have a diagnosis associated with nicotine abuse or nicotine addiction, okay? So if we add that, that increases the value of that patient. So if we see a 99213, which is 0.97 RVUs, and we add in our smoking cessation, that gets us up to 1.21 per. Okay, does that make sense? So we go from 0.97, we add 0.24, that gives us 1.21. So our value for that patient, we're essentially adding another quarter of a patient for every smoker that we have. Because as nurse practitioners, we're going to tell them to quit smoking. That's part of your job. That's part of your base education. If you walk in the room, are you a smoker? Yes. Well, I understand this is bad for you. You need to quit smoking. If you have any questions, if you'd like any assistance with that, we can help you. And, the vast majority of people are not interested in quitting, so they're going to keep smoking. Every time they come in, that's another 0.24 RVUs. Okay, we need to tell them to quit smoking. We're going to tell them to quit smoking, and we need to make sure that we bill appropriately for that. So we'll go back to the original estimation of 5,200 patients a year, okay? And this is going to vary based off of your work, and that's fine. But we're just doing this for math's sake. So if we do 5,200 patients per year, what we have to understand is that nurse practitioners as a whole are very well known for being chronic underbillers, okay? So we have people who bill 2s instead of 3s. And if you bell curve out over 2, and we say all these patients are a 2, a 99212 is worth 0.48, okay? So multiply that times 0.48, that gives us an RVU valuation of 2,496 instead of 5,044. Multiply that 2,496 by 55, that gives us a total revenue generation of 137,280. Now, you can't ask for $120,000, $110,000, $115,000 a year if you're only generating $137,000 a year. Remember that when you talk about revenue generation, you have to be able to bring in more than your salary. You have to cover your salary. You have to cover the front office staff salary. You have to cover your nurse's salary. You have to cover the overhead costs of the business. You have to cover their lights, their electricity. All those things have to be covered before you get extra money. So if we're not covering those things, we're not going to see any value. And that's how they determine what your RVU cap is. So if I'm saying your RVU cap is $3,400 per year that you have to get before you generate any extra revenue, then we have to include all that stuff in our salary. So our salary, all those other people's salaries, and the overhead cost and the profit, and then we get into making extra money. So we have to do these things, and we have to make sure that we're doing them properly. So if we're billing properly and we're coding properly and we're in family practice and we're generating over a 213 and we're getting that 5,200 patients per year, okay, and then we're generating the 5,000 RVUs, 5,044 RVUs per year, okay, then we're going to generate 277,000 as our base. Okay, that's just your base. Now, there's other things we can do. We talked about smoking cessation. Let's talking about a cerumen disimpaction. That's another very common practice in family practice. If you do a cerumen disimpaction and it's just a lavage, that's a 69209, okay? That is worth 0 RVUs. You get nothing for it. However, if you do a cerumen disimpaction and use instrumentation, it's a 69210. That is worth 0.61 RVUs. And that changes our 0.97 into a, I want to make sure I get my math right, so just bear with me, a 1.58, okay? And a 1.58 is essentially giving you a whole nother half a patient just for doing a cerumen disimpaction, okay? This is important when we're talking about reimbursement because that changes our valuation for that particular patient to $87 from $55, okay? We're generating more revenue for the client. We should generate more revenue for ourselves, okay? Other things that you can do to ensure your billing appropriately. If you do an abscess, an incision and drainage of an abscess, and you just open the skin and drain the pus out, that's a simple abscess, okay? Simple abscesses don't pay as much as complex abscesses, okay? If we do a complex abscess, which means that we insert a drain or a packing, that becomes a complex abscess. And if we talk about something like a simple finger abscess, the difference between a simple finger abscess and a complex finger abscess, valuation, your simple reimburses $272, your complex reimburses $400. That's a significant difference. And when we add RVU valuation to that, that gives us even more value, which allows us to ensure that we are evaluating the patient properly and we're treating them properly. And I like to call this maximizing revenue generation. And that sounds kind of bad from an NP standpoint, but it's not meant that way. Okay, it's not meant as a negative thing, right? Which is what some people take it as. Okay, some people will take this as a negative thing, and it's not meant that way at all. Okay, this is meant just to give you an idea of what the valuation is. Okay, so bear with me. I'm making sure I give you the correct RVU information, so I don't want to give you bad information here. Okay, I want to make sure I give you the appropriate RVUs. So a 26010, which is the simple finger abscess, is worth 1.59 RVUs, and a 26011 is worth 2.24 RVUs. Okay, so 2.5 patients for doing that abscess, which took you 5 minutes, and you packed it instead of not packing it. And that's what allows you to bill for the complexity on that. Okay, or if you document the abscess was deep, both of those things will allow you to get complexity. And complexity is what we want. Okay, we need to ensure that we're billing appropriately. If you just do a paronychia and just lance the skin, then it's a simple abscess. We don't pack those, right? So that makes it easier, okay? But if you have to incise into the soft tissue and drain it out, and you put a packing in it, make sure you document it. Documentation is what saves us on these and ensures that we're billing appropriately and we're being reimbursed appropriately. Now, that's done. Let's move on to RVU valuation. When you're being reimbursed for an RVU, the industry standard for NP reimbursement for RVUs is 25 to 35 per after you've reached your goal. If your goal is 3,000, then everything over that should be reimbursed in the 25 to 35 range. All right. That helps you understand what the valuation is, so we can ensure that we're being reimbursed properly for what we're doing. Okay, so if you get 3,000 RVUs per year, right, and then after that you get 31 per, if you make another 1,200, or let's just say 25, since that's the lowest side. Okay, that should be an extra 30 grand a year in compensation. Now, we generally do those quarterly, so divided by 4, that'd be 7,500 a quarter. Now, not everybody's going to get these numbers. Not everybody's going to maximize the revenue generation. I highly recommend that you take a coding course so you understand how to code properly. That is something we're not taught in school that we should be. We have to know how to code properly in order to make sure we're maximizing our revenue generation. These things will help us moving forward to ensure that we're capturing the revenue that we deserve and that we're doing the best interest of the patient, and to ensure our documentation is appropriate so we're being reimbursed appropriately. Okay, and when I say maximizing revenue generation, I don't mean doing something that's unethical or inappropriate for the patient. I mean ensuring that what we do, we're getting paid for, i.e. smoking cessation. If we're telling somebody to quit smoking, we need to be reimbursed for our services. No different than going to the mechanic, having him put 4 tires on your car, expecting to get paid to pay him for those 4 tires and the time it took them to put them on the car. That's part of ensuring that we're billing appropriately and we're making sure we're capturing revenue. These types of contracts are very lucrative generally, and they encourage the employee or the person who's working to make more money for the employer. Okay, if you're doing this and you're generating a lot of revenue, you need to be compensated appropriately. The flip side of this is if you're not working hard, you're not seeing a lot of patients, you're not going to be compensated appropriately. So the employer doesn't lose a significant amount of money if you're not generating a lot of revenue. But for those of you that are go-getters and runners and exceptionally efficient, this makes you a lot more productive, okay? And then when you go back to ask for things like dictation in order to make your documentation easier, or if we go back to discuss EMRs, we can say, hey, look, I can get another 3-4 patients in per day if I have these things, which would allow us to generate more revenue. And when we talk to these people about revenue generation, they like to hear that. And that's part of the basis of how I practice too. Part of my practice is based on what I call the 3 pillars of practice. And 3 pillars of practice are science, art, and business. And if you imagine yourself sitting on a stool with 3 legs, the first leg being the science of practice, and this is how we understand when to give what antidiabetic medication, when to give what antihypertensive medication, when to give what antibiotic. If we're bad at that, that leg will break, we'll fall over, we'll be unsuccessful. The second leg is the art of practice, and that's understanding that sometimes someone just needs to talk to you, okay? Someone just needs reassurance, okay? Or for instance, Mrs. Smith comes in and she's got a cough and a runny nose, and she's had these things for a couple days and no fever, no chills, nothing like that. She's not sick. She doesn't look sick. When we evaluate her based off the science of practice, we understand that she has a viral upper respiratory infection. However, based on the art of practice, we understand that Mrs. Smith's husband died of pneumonia last month, and she's absolutely terrified that she's going to die of pneumonia today. So what do? We write her prescription for a Z-Pak or whatnot and tell her not to take the medication for 2 days unless she doesn't start feeling better. And we know based off the science that 85% of the people who get that prescription will not take it if we tell them to wait 2 days. So we understand that based on the science, we're not adding any unnecessary treatments, but based on the art, that patient's going to feel better because she left that place with a prescription in her grubby little hands, okay? That makes her feel better. It's a comfort, you know? So that's part of the art. Now, as nurse practitioners, we are exceptionally good at the art of practice. For the most part. There's always that one nurse who's not, but the vast majority of us are very good at that. The third leg is the business aspect, okay? And what this boils down to is if we do not generate enough money to keep the doors open, then we can't help anybody. So we have to make sure that we maximize our revenue generation. And as nurse practitioners, we are exceptionally poor at the business aspect. We underbill chronically, which is why we have lower salaries, because we don't bill appropriately. If you don't bill appropriately, you're not going to generate enough revenue to command a higher salary. So we have to understand how to do these things. And if you understand this stuff, it makes it a lot easier. So just follow the 3 pillars of practice. I hope this was helpful on RVUs. If you have any further questions or need something more specific, just leave it in the comments or email me. You know the drill, jcdmp@yahoo.com.